I'm probably going to need you to put it where you want it.
I don't care.
You may have to be easier.
Yeah,
Quicker.
Yeah. That's a good idea. We'll have you up on the table and we'll do around the unit. So when this unit turns on, and this is called the Vectrogenesis, the screen looks like it's a touch screen, but it isn't. Okay, so just to let you know, some of them are really touch screens, like the diaphragm unit is actually a touch screen. This one is not. So just make sure you practice it that way. You choose, this machine is really nice. It has the potential to do anything that you would want except diaphragming. So it has electrotherapy, surface EMG. So you want to make sure you choose ultrasound. And then it's going to pull up another screen that's going to show you the baseline boot program that's preset. And so you're going to be adjusting that. So you go to edit. So you can edit. And now you can adjust the parameters. Now, there's a head warmer on this. Please make sure the head warmer is turned off because that can be very confusing as far as making sure you're getting to the therapeutic level and practical purposes. So when you're in clinic, you can use that. It just basically warms the sound head because when you put the gel on someone, unless you have a gel warmer, it feels really cold. And when you start the ultrasound treatment, it'll feel really cold. So the head warmer just kind of takes a little of the edge off of it. But if you're using the head warmer, I can't tell if you get to the right level because the person's already feeling heat. Okay.
So it has nothing to do with the thermal?
No. This is just physically warming the head. So you want to make sure that's turned off. And then on the right-hand side, you're going to see frequency, duty cycle, and then display and intensity in watts per centimeter squared. So 1 megahertz does what? How deep does that go? It goes deeper. Okay. So we have to look at the area that we're treating and decide, is this deep or superficial application? Okay. So we're going to do a superficial application, which means I'm going to change it. Now, in this particular unit, our options are 1 and 3.3. On some of the other unit, there's another unit that's it's 1, 2, and 3, and then on another unit, it's just 1 and 3. If I tell you to do a superficial application, you do 1, and I'll tell you actually on a practical what level I want you to do it at. You'll give exactly the parameters that you need, except the intensity. And if it's continuous, I'm expecting you to do the treatment until the person begins to feel a mild warming sensation. It typically takes about a minute to get to that point. Your book says 2 to 3 minutes, but usually by a minute you're starting to feel the warming. If you're not feeling it after a minute, you can increase the intensity. If you are feeling it, you can stop. You're at where you need to be. Yes?
If it only takes a minute, is that the same type of thing like ultrasound where you can only charge if it's 8 minutes or more?
Well, that's just to get to the therapeutic level. You're not stopping the treatment.
Oh, okay.
You're going to continue doing the treatment for the full 8 minutes. You stop increasing the intensity,
okay.
You leave it there, and now you complete your treatment. Okay. If you're doing a superficial area and you're doing a continuous setting, you generally don't have to turn the intensity up very much to get that mild heating. Usually it's going to be somewhere between 0.5 and 1 watts per centimeter squared because it's very superficial, so it doesn't take much. So if you're getting up to 3 watts per centimeter squared, something's wrong, okay? And they're not feeling it. Maybe the unit isn't actually turned on and you're increasing it, the number's increasing and they're not feeling anything, but you need to stop and pause it until you figure out what's happening, okay? And turn it down. If you're doing a pulsed application, remember the 20% pulsed is what most of the research is done on, and that is for non-thermal effects. You don't need to go above 0.5 to 0.8. Once you get there, they're not going to feel anything, you can stop. Don't keep trying to increase it and ask them if they feel it. They won't. Okay? So you don't need to go beyond 0.5 to 0.8. 0.8 perfectly. Okay? And then for 1 megahertz, that's a deeper application. You're going to need to go higher in intensity. Because remember, things absorb, attenuate over the distance. So you want to make sure it's high enough to get to those deeper layers. Okay, so usually that's somewhere between 1 and 2.5 watts per centimeter squared for continuous to field thermal applications. Okay, any questions on anything I've said so far? Okay. So again, on your practical, I am going to tell you exactly what you need to do. So you won't have to make any decisions on the practical as far as that's concerned. You only need to make decisions on the written in terms of what settings to utilize. So this is considered a 5 centimeter squared sound head. Remember that the actual ERA is a little smaller, so you're treating 5 to 10 minutes for 2 times this. See how small the area is that you should be using. I don't know if some of you have volunteered in clinics and see people doing like an entire lower back. They're not doing an effective treatment. It's part of the reason why the research doesn't necessarily show improvements, because it's not being applied correctly. Okay. There needs to be 50% overlap in your application area. So whether you use a horizontal stroke or circles, there always needs to be 50% overlap for each consecutive circle or stroke that you do, okay, in order to do an effective application. In general, I'm going to have you lie down. Positioning, I would expect the same positioning that I would do for any other application. Person should be comfortable, because remember, you're going to be doing this for 8 minutes. So the way she was sitting when I first started, I've actually had students do ultrasounds in that position. But, well, that's remediation. Nobody's going to want to sit like that for 9 minutes. So please practice your positioning when you do your applications, because what I see is, you know the positions when I ask you, but out of habit, because you're just practicing on each other in any old position, on the practical, you will do what you practice. And so I see all kinds of funky positioning. And unfortunately, that's going to count against you. So you have to really practice all aspects of the treatment application. So let's say she has iliotibial band syndrome. Anybody know what that is?
Tight agent.
So a tight band that's kind of snapping around the knee, and it creates inflammation and discomfort.
So does that belong to?
Oh yeah. So you clean the area that you're going to treat so that you're getting any kind of short cord. And she's subacute, so I want a thermal effect. If she was acute, I'd want non-thermal effect. Takes a second. So try not to turn it off when you're in practice, because you'll freak out because it takes a second. All right, so again, billable is 8 minutes, right? Plus, I have a good enough treatment area. I want to get a good treatment in here, so 8 minutes is a good time frame. Is this superficial or deep? It's superficial. So I'm going to get the higher megahertz. We're going to leave it on 100% duty cycle because I want a thermal effect. I'm going to leave it on watts per centimeter squared. You can actually change it to watts. The watts per centimeter squared. Watts is just giving you total power, energy being delivered over the area. This is telling me per square area what I'm delivering, which is to me more meaningful. And my head warmer is off. My treatment time, I'm going to increase to 8 minutes. Okay, and now I'm ready to deliver the ultrasound.
To get the thermal effect, would you only do continuous, or could you do like the pulsating one that's one?
You could do a higher pulse, but generally the most thermal effect is going to be with continuous. So this is a bit of a messy treatment. Just be aware. Now the amount of gel, I usually put the gel on the person. I've seen therapists who put the gel on the sound head. I don't know, I feel like you don't have enough gel, and I feel like you never can have too much gel. Because what happens is, as you're doing it, it drifts away, and you end up not enough gel. Now,
Much, then not,
Right.
because not, it won't transmit it.
if you're moving the sound head and it's actually sticking to the person, you don't have enough gel. Now, the way Dr. Z does it, and I'm going to show you the way he does it because he floats in and out of here, is he uses a tongue depressor and he keeps moving the gel back into his face. I am so right-handed, I can't do it. So I just take my gel, and if I need more, okay? Because I'm not ambidextrous and I can't do the whole maneuver. One of the things you want to be cautious of is don't lift and swirl the sound head, okay? Because again, you're changing the delivery, okay? So you'll see a lot of therapists scoop with the sound head. Don't do that. Just squirt more in the area, or use your tongue depressor and move it into the area, okay? Because you're changing the delivery of the sound waves.
How about contact? I heard that if you don't have, like, because of the crystals bouncing around, if you don't have contact, it can damage the unit.
Yes.
So you
always want to, you put the, before you turn it on and turn it up, you want to make sure that, you have contact with the person, that there's gel there, because you could damage the crystal. All right. So I have it on 0, so I'm going to start. And what you have to learn how to do is be able to do 2 things at once. So that's why you kind of want this close in your line of view. And then I can turn this up. And then I have to wait a minute or so to see if she starts to feel the intensity. And if she doesn't, I can turn it up until we get to that.
How high are you right now?
I am at 0.7 watts per centimeter squared. So in general, when you first turn it up, you guys turn it to 0.5 and see what happens.
You're putting some pressure as you're.
Yeah, I feel like it actually, when I have done treatments on people, if I do it really right, I feel like that changes the contact, so I always put a little pressure on it. Not a lot, I'm not causing pain. I just want to make sure I'm on the because remember, the body is not a flat surface, it's rounded, and if I'm making light contact, there are literally areas that I could be lifting off the tissue, and then that changes the delivery. So again, my treatment area is generally 2 times the size of the sound head, and it's 5 to 10 minutes per treatment area. Okay. Now, it used to be that depending on how fast you move the sound head, and it still really applies, if you're moving it, it's not going to build up heat as much. So in general, you want to move it kind of slow. So you're giving the tissues a chance to build up.
Do you kind of stay, I know you don't want to just hold it in one spot and you're moving it, but do you kind of stay in one spot until you figure out if it's getting heated up in that area, or do you go across that whole area?
You keep moving it. You keep moving the sound head. You don't stay over one spot because then you're not moving it.
And you can't lift it off.
No, you cannot lift it off. Now Dr. Z would probably, that's hard for me to do. They go like that. To me, it's not worth it. So at 1 watts per centimeter squared, which is pretty appropriate, she's feeling it. If you're going over a slightly deeper area and you're moving really fast, you may not feel it. So that's why the delivery can change from person to person. So if I'm delivering it like this, okay, I may have to go up to 1.5. So that is why if the therapist gives you an exact number, it can become difficult. So you have to turn it up as long as it's below the number that they've given in the plan of care. You can give in anything up to that point. Just describe that as the thermal dosage, so that it's clear. Don't go above the plan of care. Oh, I sent an email to them. Or to the third one. So you can see now that it's kind of a long time. So this is, you want to be making sure that you're in a good position and you're comfortable, and that your arm is in a good position. You don't want to be delivering this in an awkward position, because you will fatigue out, and then you'll be like, oh God, I have 4 minutes left. Okay, so make sure you're comfortable, they're comfortable, you're in a good position. All the supplies that you have are here.
Feeling anything right now, brother? Good.
What are you at now?
1 watt per centimeter squared.
You start at 0.7. So then you would stop now because she is feeling the heat.
I would stop turning it up.
Yeah.
I wouldn't turn it up anymore. As soon as she's feeling it, I'm getting what I want. I don't need to go any higher. Remember, we tickle, not hammer. We tickle tissues, we don't hammer them.
So you consider the treatment time from the point at which it starts to have
No,
an
I
effect,
just the whole treatment. I don't calculate it out well. It was 6.5 minutes. It's good enough. It's close enough. Remember, it's 5 to 10 minutes to be effective.
Did we turn it up to 0.8?
1.0.
Remember to use what you have for your body mechanics. If the table goes up, you're more comfortable with the table up, raise the table up. If you can sit, it's perfectly fine to sit. So just make sure that, if you're doing an outpatient clinic, if you're doing a lot of modalities, you want to make sure that you're not wasting your back.
And that really is key, because this can get tired. Your arm gets tired when you're doing this, and that's when you get sloppy. So you want to make sure you're moving the sound head to the contour of the tissues. So if the tissues are rounding up on the top, and on that part of my treatment area, I want to make sure that I get to those areas. Don't go straight like this, okay, and come off. And a lot of people will do that. You have to follow the contours of the tissues. Because remember, things are reflective, refracted, and attenuated. We want to enhance absorption, not refraction and reflection.
Sorry to interrupt.
And you said it was IT band syndrome that you're trying to treat. Now, would this be the modality that you would choose to use, or would you rather use?
Yeah, because it's fascia.
Okay.
It's a fascial tissue. So yeah.
But you said it's more superficial fascia, correct?
Yes, that's why. It's right underneath here. When I push on it, in general, a person would say, ow. It's very superficial. Yes, they are out there.
How will you stay this
So I would say I did 8 minutes of continuous ultrasound, increasing to 1.0 watts per centimeter squared, to the iliotibial band, distal component, lateral agreement.
You don't even include the
Not the
duty cycle
objective,
or.
right?
I said continuous.
No longer objective. I'll be under objective.
Yes, that's the application, yes. Under objective goes your treatment and any measurements that you've done. Okay? And all aspects of treatment, by the way. If you're doing gait training, for example, you need to put in the amount of assistance, the type of gait pattern. That doesn't go in assessment, it goes in objective. Okay? So that tells me we're done. Sound head off, put it down, and then skin. Now, ultrasound gel can get itchy. I know when I've had treatments, it drives me nuts. So if that's the case here, you might want to get it off. I don't know why. To me, it gets very itchy, so I want to make sure that off of her, so she's not going to get itchy.
And what is the ultrasound gel made of?
I don't know. I don't know. It's mostly water, but I don't know what else is in it. You have to look at the container. Dippity doo.
So people don't tend to be allergic to it, right?
No, people, because it's mostly water. I don't know what makes it itchy. Maybe because it's so drying. When it dries on your skin, it kind of it can get flaky.
I was just wondering for like allergy purposes of the skin dermatitis.
I haven't had anyone allergic to it ever. And this is what they use. I mean, this is the same basic technology that they use when they look at babies. So it's just a different frequency. Okay, so you got to assume, or any kind of other ultrasonic
That's
diagnostic
pretty safe to put on.
Is that why it's okay to use some ultrasounds for pregnancy and it's contraindicated here since it's a different frequency?
Yes, it's a different frequency. So they're just looking to give an outline of something, where here it's penetrating to those tissues.
They're never using it at a thermal level.
All right, so that's application. If I decided I wanted pulsed instead, the setup would be essentially the same, except I would put the duty cycle that I wanted. So if she was very inflamed, I would do 20%. Okay. And then now, what do I turn it up to? Because she can't feel it. 0.8. 0.8. I don't need to go any higher. Research says 0.8 is effective. I go to 0.8. I don't need to go any higher than that.
So the only time you would turn it up is when you're doing thermal.
That's the only reason you would turn it up. Mostly continuous. Okay. I forgot to ask questions, but basically, do I need to ask her if she's pregnant? I need to ask her, this is because I'm using a heating element to it, does she have a blood clot in the area? And I'm looking at her. What happens when someone has a blood clot in their lower extremity? What does it look like? Do you know?
Red, hot, swollen.
Right. It looks red, hot, swollen. Oftentimes the entire leg is uniformly swollen. If you're seeing that, that's a good question to ask. Okay? Because that's what that could be. It could be other things too, but that's what that could be.
On a clear post-surgical patient, that's times you kind of pique your interest that they could have a blood clot if they had a recent surgery.
And then I guess the location, if she was younger, the epiphyseal plate.
Right. If she were younger, I'd be worried about growth plates, blood clots, and metal in the area, cancer in the area. Not so much for her, for plastic or prostheses, but believe it or not, they're really doing joint replacements in younger and younger people these days. So if you see a scar over the center or around the side, you need to ask, okay? Because they could very well have had some kind of joint replacement.
You said the metal's not...
It's not the metal, it just guides you to ask about the plastic and the cement. Metal is for diathermy per se,
No.
and not for ultrasound. It just kind of bounces off of it. So metal is not the problem, but the plastic can heat up and the cement can heat up.
They don't know what it's saying in their chart from the surgeon?
It should say it in their chart. If they don't know it and I'm not sure, I don't do it.
Yeah, that's what. Would it be safe if I see a scar and I ask them, they know they had a knee replacement or something? Would it be safe if I just, because I didn't feel comfortable, if I just stayed away from doing that?
Yeah, I would just get on the horn and call the therapist and say, hey, they're telling me they had a joint replacement. They don't know if they had cement or usually a knee is press fit, but they don't know. So, what do you know?
Yeah.
The therapist may know, or if they don't know, then don't do it. Just skip that part of it until you can clarify.
I didn't know if we would get, if it's like insubordination or something. If you're
well, you might get yelled at, but you're following your license.
This is your license, yeah.
Yeah, you're following your license, so they have no right. But I can't guarantee you. I mean, I've had my head ripped off for less, so I can't guarantee that someone's not going to say something to you. But you're protecting the patient, so there's nothing wrong with that. To clarify it. Now, if you kind of just blew it off and just stopped doing it and didn't contact the therapist, then maybe you deserve a little yelling at.
There's always another modality that you could probably.
Yeah, I would just do moist heat then until I knew. Okay. Now the other thing you can do, which is kind of nice with the ultrasound, and that it is, well, you can do with heat too, is position her so that you're stretching at the same time. So what, if I'm doing the iliotibial band, what position would that be? Think back to test and measures. What position would that be?
Side, but on the other side.
Sideline.
Sideline.
Right? So I can have her sideline.
Does it have a name?
Yeah, someone.
Over.
Over.
There you go. I can have her on her side, and I can put, you know, pillows to help me support the leg, and I can kind of get her in this position, or I can use a little bench or something to hold her, and then I can do the ultrasound here. Or I can even hold her and do it, you know, once I have it set up in this position. So I'm getting a stretch while I'm heating the tissues. Okay. As long as it's not hurting her. I don't want her in pain while I'm doing this for 9 minutes. Okay.
Question. Going back to like the metal thing, like the knee replacement per se. You said you would go to like, you know, moist heat. But still, even if you didn't know if they had metal in